This has been a video that I've been meaning to make for a long time. I'm gonna talk about IUDs and what options are available to you for pain control during the insertion of an IUD. I have two videos on my channel about IUD. One is going to be 5 things that I want you to know before you get an IUD. I go into all of the details. I'm gonna leave it linked down below. 5 things you need to know before getting an IUD. The other video is an insertion and removal video where I walk you through the insertion process. And now a lot of people were upset in the comments of the insertion video because I didn't go over pain control options. So today's video, I'm gonna talk about pain control. And we're gonna cover about 6 different options available for pain control. I almost forgot to mention that I actually have a 3rd video on IUDs on the removal process. What happens if we can't find the strings? What do we do now? How do we remove it? What are options available to you? So there's actually 3 videos that I've done on IUDs, which is pretty crazy to think about, but I'm gonna leave everything linked down below. As I mentioned before, people were upset in the comment section of the insertion video because of my lack of talking about pain control options, as well as mentioning the tenaculum. So let's talk a little bit about insertion. This is of course my example of an IUD. It's not one that has been used. And this is my little model of how I demonstrate insertion. This is the applicator of how we insert it. Now, when we insert the IUD, it goes through the cervix, which is this bottom part right here. As you can see it go in, this is the cervix. Oftentimes, we use this instrument called the tenaculum. I don't have one here with me, but I will insert a picture here. This instrument is scary looking. It looks morbid. I completely understand that. I personally have had an IUD. I had one in for 6 years. I loved it. But yeah, the instrument, it looks scary, I'm not gonna lie. The purpose of the tenaculum is to grasp the anterior lip or posterior lip, so either the top or the bottom of the cervix, to help stabilize the uterus, so it minimizes the risk of perforating the uterus or kind of going past and making a little hole in the uterus while we place it. Now the chance of that happening is less than 1%. And honestly, I have placed IUDs without the use of tenaculum. It just has to be the right patient. And you also wanna make sure that you're doing it under ultrasound guidance so that actually you can see the instrument going into the uterus and so that you don't go past and perforate. Now, you don't always have to use an ultrasound. That's just my preference or patient preference. It really just depends, so have a conversation with your doctor. The tenaculum, it does grasp the anterior or posterior lip of the cervix, and we kind of hold a little bit of traction on it. Helps us guide the instrument through the cervix. Once we reach the top, then we can deploy the IUD. There we go. And the IUD is in place. You can see the strings, then we would cut the strings. Again, in the insertion video, I go into much more detail. Before I jump into the pain control options, keep in mind that everyone's perception of pain is very different. I have placed IUDs in patients that don't even feel it. They're like, oh, you're done, or I didn't feel anything. And those are usually the patients that have had multiple vaginal deliveries, have just delivered a baby recently, and they don't have a perception of pain, or they don't think it's that big of a deal. On the flip side of things, I have placed IUDs in patients where it is excruciatingly painful. They either pass out from the pain or have a vasovagal episode where they just get very worked up and anxious and are on the brink of passing out. So there's a large spectrum because we all perceive pain differently. Same as labor and delivery and when you're having a baby. I have patients that feel a lot of pain with the first couple contractions, or maybe when they're 1 to 2 centimeters dilated. And then I have patients that they're like, this is nothing, and they don't really feel that much pain until they're maybe 8 to 9 centimeters dilated. But that is no excuse. It's your perception of pain. So if you're in pain, if you're uncomfortable, we need to do something about it, and your doctor should make a big deal out of it because ultimately you need to feel comfortable while you're having this procedure done. As I mentioned before, I have had an IUD. I had one placed when I was in residency, and I had it in for 6 years. I wanna say I got it in 2018, maybe 2017. I think it was 2017. Getting an IUD in for me, again, this was my perception of pain. It was pretty painful. It was cramping. So it wasn't anything that was sharpshooting in pain or anything like that. It just felt like a really intense menstrual cramp, and the cramping started when the tenaculum was used on my cervix and then also during the insertion process. Now, I wouldn't say it was the worst pain of my life, but I was definitely uncomfortable. Before getting my IUD placed, I didn't take any ibuprofen or Tylenol or anything like that. I just went to my appointment. Afterward, my doctor did write me a prescription for narcotics. She wrote me a prescription for Tylenol 3 in case I needed it. I never actually filled it. I just went home that day and I had some chocolate, some heat packs that I put on my belly, and some wine, and that pretty much was all I needed, and I was fine. But again, that was my personal experience. That's not to say that's what you will go through, but I'm just being honest and sharing my story and my experience. I would say for the next 3 days or so, because I went back to work the next day, I was probably a little crampy off and on, and I had a little bit of spotting, but it wasn't anything excruciating painful. Like I said, I was in residency, so I went back to work. I was covering labor and delivery. I was able to work without any issues, without having to continuously take ibuprofen or anything like that. What exactly causes the pain during an IUD insertion? One is going to be the tenaculum. When we grasp that cervix with the tenaculum, that is what's going to initiate that cramping pain. 2 is going to be anytime you mess with the cervix. This is similar to when we check your cervix when you're pregnant, or maybe sometimes when you get a pap smear, you can get a little discomfort and a little crampy. Even though we don't mess that much with the cervix, it can still kind of cause that same sensation, just because the cervix is a sensitive part of the body. So anytime we mess with it, touch it, measure it, anything like that, it's gonna cause a little bit of discomfort. Or it may cause a lot of discomfort because we're all different. 3, measuring the uterus is also going to cause discomfort. As I mentioned in my insertion video, we have to know the cavity length or how big your uterus is in order to place an IUD, so that we know that we're placing it in the correct location. Usually this is done with an instrument called the uterine sound. I don't have one here with me, but as you can see on this device, this is where the IUD is. You can see that there's numbers on it, and those are referencing centimeters. So once we measure the uterus with the uterine sound, then we can line it up with this applicator so that we're placing it in the correct location. So say your uterus measures 7 centimeters, we move this little gray knob to the 7 centimeter mark. Then we get to the cervix, we insert through the cervix, and then once we hit that 7 centimeter hub of the marker right there, then we know we're at the fundus or the top of the uterus. We can pull back slightly and then deploy the IUD. So this process of measuring your uterus and then inserting the device is also going to be a cause for pain. Now, the reason why you're here, what can we do for pain control during IUD insertion? In my practice, I have this conversation with all of my patients, and I let my patients choose what they would like to do for pain control, or we can work on it together, what I think is going to work best for them, and make this a very individualized part of their care. So I'm gonna go with the least invasive pain control option to then the most intense. So let's start. 1 is going to be ibuprofen before your appointment. Typically, we recommend taking ibuprofen about 1 to 2 hours before your appointment. It's not going to work if you're just doing it in the waiting room and you take it, or when you show up for the appointment. So be prepared and take this beforehand. Ibuprofen is going to help with that cramping pain. Now, like I tell all of my patients, is it going to completely take away all of the pain? Absolutely not. Everyone responds to it differently, but I wouldn't bank on that. It's just going to help during the process and help decrease the amount of cramping you feel. Number 2 is going to be using a numbing spray. Again, this is something that I honestly universally offer and do for the majority of my patients as long as they want it, but it is a local numbing spray that I can use prior to the insertion process, prior to placing a tenaculum on the cervix, and it is sprayed on the cervix and it causes a numbing sensation. Again, it may not 100% take away the pain, but in my patients where I don't do it versus the ones that I do it, they report that it does help with the pain. 3 is going to be a paracervical block. I'm gonna insert a picture here so you guys kind of understand, but a paracervical block is going to be with the use of a local anesthetic. Usually we use lidocaine, and it is inserted around the cervix to help numb that area, and again, it should work to decrease that pain and that cramping sensation that you feel when the tenaculum is placed and also when the IUD is placed. Now, the downside of that is that yes, sometimes placing the paracervical block, at least the initial injection, because it is an injection used with a needle, that can cause discomfort, but that usually goes away within 30 seconds to a minute, but it's not a pain-free process. It just makes it more bearable. So expect it to be slightly uncomfortable, but then in the end, it gets better. Option number 4 is to prescribe you a narcotic, things like Percocet, before your appointment, so that you take Percocet with maybe some ibuprofen before your appointment, so that helps keep you more relaxed and help with your pain. The caveat to this is that you need someone to drive you to the appointment and someone to drive you home from the appointment, because a side effect of strong narcotics is that you're gonna feel loopy, lightheaded sometimes, and sleepy, so we can't have you driving. So if you have no one to drive you to and from the appointment, then this is not gonna be an option for you. Oftentimes, a lot of patients choose this option when they come see me initially for a consult to talk about birth control or IUDs. Then I send a prescription to their pharmacy, they pick it up and then come back in a couple days or a week for their IUD. And they usually take the Percocet an hour before their appointment, and then they come and have it placed, and they typically do very well during the insertion process. The 5th option that you can do for pain control is going to be an anxiety medication plus a narcotic. So this is typically me prescribing an anxiolytic like Valium and Percocet before. The anxiety medication helps keep you more relaxed and keep your mind off of things, and then the Percocet is going to help with the pain. But again, the combination of these two, everyone experiences different side effects. So you need to have someone drive you to the appointment and then drive you back home and kind of hang out with you and keep an eye on you. Again, this is a popular option with my patients because that's something they want to do and they typically do really well. The 6th option for pain control is to do the IUD insertion under conscious sedation. Now, not all OBGYN offices may have the resources to offer this, so you need to ask beforehand. Under conscious sedation, it means that an anesthesiologist or a CRNA would come in and give you medication through an IV to do what's called twilight anesthesia. So you're not intubated by any means or anything like that, but it's almost like you're in La La Land. So again, this requires outside resources. It's usually done on a procedure day. Anesthesia needs to be in-house, and obviously being put under conscious sedation has its own set of risk factors. Now, here's the big issue with our healthcare system and conscious sedation. Unfortunately, the use of conscious sedation with the insertion of an IUD is typically not covered by your insurance. That's not our fault as physicians, that's just the way the US healthcare system is right now, that they don't see it as a necessity to place IUDs under conscious sedation. So you want to make sure and call your insurance beforehand or talk to the office that you're going to see if they know what the cost would be or how much your insurance would cover. I know that patients have been quoted in the $1,000 range, if not more, which is absurd and ridiculous, but you also want to keep that in mind because you don't want to agree to do it and then get like a huge medical bill from all of this. Sucks, and I don't agree with it, but I'm being completely honest. There's actually 7 options, I forgot, but I have it down in my list here. But the 7th option for pain control is to do the insertion in an operating room. This would be doing the placement of an IUD completely under general anesthesia, so you are put to sleep. This is usually done in a hospital setting. Again, likely not going to be covered by insurance, but who knows, it may be worth it to call and ask and get a quote to see how much that would cost. Now, the times that I have placed an IUD in the operating room is for someone that actually needed it to be done in an operating room. This may be a patient with disabilities, a patient with intellectual disability, a mental health disorder, anything like that where this procedure cannot be done in an office setting, or the patient themselves cannot tolerate being awake or being in twilight anesthesia or anything like that, where they actually need to be put to sleep. And in those instances, a lot of the times insurance does cover it because it is a medical reason and a necessity to have the patient be put under general anesthesia. Those are the 7 options for pain control when we talk about IUD insertion. Ultimately, what I want you to get out of this video is that you need to talk to your doctor, to your medical provider that is placing your IUD, and you need to discuss these options for pain. And you ultimately should get to choose what you want to do for pain control during this procedure. I hope at some point in the future we come up with a better way to insert IUDs so that it's not quite as painful, but I think there's still research that needs to be done. I personally had a really positive experience with my IUD and I loved it. I had it for 6 years and I was really happy on it. It helped, 1, work as birth control and prevent pregnancy, but 2, also helped with my problem of heavy bleeding. It honestly took my period away and I loved it. I am currently pregnant, but my plan is to get another IUD after delivery because I loved it so much. I hope you guys found this video helpful, empowering, because knowledge is power and you should know all of the options available to you when you're having any sort of medical procedure done. Remember, talk to your doctor about it, advocate for yourself. That's the most important thing that you can do. That's the end of my video. I hope you guys enjoyed it, learned something new. Leave in the comments your experience with an IUD. If you got the IUD and you advocated for yourself, what pain control options did you use? Did it work? I truly want to know. And yeah, we'll just talk about it in the comments. I love you guys. I hope you have an amazing week. Check back next Sunday for another new video. Bye.